Hello, okay, so today I'm going to walk you through how to use this kit which you'll find on most wards to test a blood glucose level. It is very important that we do this on most patients, especially if they've got type 1 or type 2 diabetes, but there is other reasons of why we do it, which I'll get into later. It is pretty vital that we do these, especially before meals, because we need to understand and monitor where their glucose levels are and if we need to implement any further actions. Okay, so first of all, did you know an average amount of where a good glucose level sits?
Is it is between 8 and 4?
Yeah, so 4 and 8 is your average and your normal reading. If it is below, which is considered hypoglycemia, that's when there's not enough blood sugar in your glucose in your blood sugar. If it's hyper, which is if it's above 8, that means that they've got too much. So the way we test this is we use I use this kit which you find on every ward in a hospital. You'll find there's multiple there. So we use, this is called a
Glucometer?
A glucometer, a lancet, an electrode, and then we have some alcohol wipes as well to do the finger, to wipe the finger. So first of all, before we even start, you need to prepare hand hygiene for 30 seconds. Wash your hands with hot soapy water. Then you need to put on some sterile gloves. Okay, so at the moment I'm going to use the alcohol gel. So I'll walk you through it step by step on how to actually do it. So just before my hand hygiene, I'm going to put on my non-sterile gloves. Alright, cool. So with our machine, we grab an electrode, and as you can see that there's a little arrow that points down. So we rip that down, and then it'll pop out with the 3 lines on top. That's the electrode. Make sure nothing touches that, as that goes into the machine, and it can affect the reading if there is any bacteria or anything that goes onto it. So you pop that in the machine. It turns the machine on straight away. Now what you need to be wary of is the fact that there is a number up the top, and that needs to match the number on the back of your electrode. Now the reasoning for this is it needs to be calibrated together, otherwise there will be an inaccurate reading, and therefore there was no point in doing the BGL. Okay, so we've got our machine all ready to go. Now what we need to do is, usually with a patient, we get them to perform their own hand hygiene with warm soapy water. However, if your patient is bedbound, can't really do that, we do usually use an alcohol wipe, and we just wipe that on the finger. And so we only use these 3 fingers, and we prick it on the side of the finger. This is because there's less nerve endings there, and it's less sensitive for the patient. So if we did it on the top of the finger, throughout the day, it still might be a bit sore for the patient, and when they're going to touch things, that could not be nice for them. So we're just going to wipe the finger. Now we've got to let this alcohol dry on the finger. If it's still wet, it can affect the reading. Okay, so we've got our electrode in. Now we grab our lancet and we take the top off, and we need to make sure we milk the finger. That helps just the blood go down, and we also need to hold the finger below the heart. If it's above the heart, then you don't get an accurate reading and the blood goes back to the heart. So we just milk the finger, and then we just prick it on the side, and then once all the blood's there, you put the electrode just below it and let the blood drip onto the electrode, and it'll go all the way to the top, and then it'll start counting down for about 20 seconds, and that'll give you your reading. You also put a cotton bud straight onto the patient, make sure they don't bleed out, because that can also be a bit painful for them. Other than that, that is how you've taken your blood glucose level reading. Okay, that you would then continue to document that straight into the patient's notes, so then the doctors and the other nurses can keep track of what their readings are. So if it was hypo, which is is that below or
That's
4?
below.
Cool. Yeah, so if it's below, that's when you would implement a fast acting and a long-term acting carbohydrate. And that would mean getting them to have a bit of highly concentrated cordial, get that down, and then give them maybe a sandwich, which is a long acting carbohydrate. You would then come back in about half an hour, and that's when you would take the blood glucose levels again, and that'll be able to test a better reading, and hopefully it would have gone up by then. However, if your patient is unresponsive and they can't swallow anything, we do have a hypoglycemia kit, which is also found on the wards. There are just some instructions on the back here, and you just follow the protocols here. So we have this carbo test glucose solution. If the patient is a little bit able to swallow, you give them a little bit of that, and that's a quick, fast-acting carbohydrate as such, and then you would follow them on with something a little bit later. Other than that, then we've got a glucogen hypo kit here, which is pretty much just like insulin, and it's just a bit of like a needle that gets put into their, I think it's usually their stomach, like the fatty areas, and that also helps to bring up their levels. Now, do you feel like you're really comfortable in performing a blood glucose level reading on a patient?
Yeah, I think I am now.
You are?
Yeah.
Would you like to try it on me?
Sure. Okay.
So the same gloves.
So first off, I would introduce myself to the patient that I'm talking to.
Yeah.
Tell them what's going to happen. Get myself ready, so I do an idea of myself, and then as well as the patient as well.
Yeah.
So I would grab the glucometer, and then
yeah, you can just use this one.
Yep. And then I'll just put that into there.
Yeah.
Without touching the non-sterile area.
Yeah.
Sterile area, sorry. I would get an alcohol wipe. I would set myself up before I
Perfect. Yes.
prick the finger. So I've done my hand hygiene. I'm now putting on non-sterile gloves.
Yes. Also, something I forgot to mention a little bit earlier, but is really vital, is that once you've pricked your finger, it needs to go into the sharps container. So you usually there's a little yellow container which you find next to the BGL kits on the wards. Bring that with you, put that straight in there. It's just for safety, just for So make sure those things go into the sharps container.
Lovely. Okay, so I have, considering this patient is bedbound, they can't wash their hands with warm soapy water, so I'll just use an alcohol wipe.
Perfect.
And just let that dry, because if it doesn't dry and you prick the finger, you'll get an incorrect reading.
Yeah.
And then I'll use these 2 fingers. Just gonna use that one. Put that aside. And then I'll set myself up so I'm ready to prick, and I would just go from the side of the finger, because doesn't have as many nerve endings.
Yeah.
And press it in, and then and milk it. I should have done that before, but I'm doing it afterwards. And then below the blood, and then it'll just slide into the thing, and then let that go until it gives you a reading.
Yeah.
I'll give you a cotton ball.
Yeah.
And just hold that. A reading between 4 and 8 is good, no matter wherever.
Yeah.
If it's above, that's hyper.
Awesome.
And there's not really much we can do as nurses. But if it's hypo, we can use the hypoglycemia kit.
Yeah.
Which, if they're still conscious and they're able to swallow, would give them a highly concentrated sugary drink. So cordial, carbo test, which is just really high to concentrate, doesn't taste nice. If they are unable to swallow, then we'd give them an intramuscular injection, which is just full of glucose, so that goes straight into the bloodstream.
Cool.
So
Cool.
And there's a protocol on the back, so just follow that and it should be okay.
And so you feel comfortable and everything performing that within a clinical setting? Did you have any other questions about any of this?
No, I don't think so.
No, you're alright. Alright, I've got some notes here. If you just want to go through that, just in your own time, just gives you a bit more of that background information on what type 1 and type 2 diabetes are and how we manage it as well.
Lovely. Thank you.
Cool.